But first, we take a look at the COVID-19 vaccine mandate that applies to businesses with 100 or more employees. The rules released go into effect January 4th, but not without opposition. It applies to businesses, as I just said, with 100 or more employees. Businesses have until January 4th, and all unvaccinated people will have to be tested if they do not get the vaccine. U.S. Senator John Boozman is here now talking about challenging this mandate. First of all, Senator, thank you so much for joining us today.
No, thank you so much for having me as always, Don. It's good to be with you.
Well, to get started into this, I just want to hear your thoughts on the president's mandate.
Well, I'm very much opposed to it. I don't think that OSHA has the authority to do this. This is so sweeping. Besides that, it's going to, as I go around Arkansas, the two things I hear about are labor and the supply chain. And this is going to dramatically disrupt that also. I'm a guy that believes very strongly in vaccinations. I have a past in the medical field. I'm an optometrist. My brother was an ophthalmologist with a large clinic. And so I've really encouraged people to get vaccinated. I think we can be so proud as a nation, the great job that we did in developing the vaccination time speed that we did. On the other hand, there's lots of people, many in the medical profession, many throughout various careers, doing all kinds of things that just feel strongly that this isn't for them. We should respect that. And the idea of just coming down in a very heavy-handed way and saying, you've got to do this, is not productive, and I don't think it's helpful at all. The other thing that, as you recapped about the law, was the fact that the fines are really heavy-handed. I think up to $130,000 for businesses. You know, if you make a false statement, you're talking about a $10,000 fine as an individual, and 6 months in jail potentially. So this is simply unacceptable. In Congress, what we're doing is pushing back. I think there'll be a lot of legal suits, and I think the courts will be with those that sue. On the other hand, we're pushing back with a Congressional Review Act, and this is a thing that we can use to stop various things from coming into effect that the administration pushes out through the agencies.
Okay.
Have to have a vote within 60 days, and I think we've got a good chance of actually winning that vote.
You know what, I want to get into the specifics on what you and I guess it's a total of 40 senators plan to do to challenge this mandate. But before we do, I want to put this graphic back on the screen. Unvaccinated workers must begin wearing masks by December 5th and provide a negative COVID test on a weekly basis. That would be after January 4th. And companies are not required to pay for or provide COVID tests unless otherwise required by state laws, local laws, and labor union contracts. Also, Senator, there's another component to all of this. There's the CMS part. That's the Centers for Medicare and Medicaid Services. They will require healthcare workers at facilities participating in Medicare and Medicaid to be fully vaccinated. One affects 84 million people. The other one affects 17 million people. I'm wondering, since there are two components to this, and some people may not understand that until now, how do you intend to address both?
Well, we can overturn the OSHA regulation that's come out by Congress. And so that's what myself and many other senators, Senator Cotton included, are leading the charge in making sure that we have that vote. This particular vote in the Senate is unusual in the sense it only takes 51. And so we're a long way towards achieving that. But I think that the American public is going to stand up and just say, no,
okay.
This is all I have about for the last several days, and it's just simply unacceptable.
That's a very good point to make. You say you believe the American public will stand up and say no. Let's talk about corporations like Tyson's. Tyson, right here in Arkansas, they've implemented a vaccine requirement, and they have a large majority of their workers vaccinated. There are other companies that have done the same thing. So when you speak of this, do you think everyone is in agreement with you on that? My guess would be no.
No, I think everyone is in agreement that if you're a company, well, if you're a company and you want to vaccinate, that's one thing. If you're the federal government saying that everyone has to vaccinate, every company, whether they want to or not, that's a totally different situation.
Okay.
That's the situation that we're in now. And I worry about Tyson's, I worry about other places because the labor force right now is so slight. Our trucking industry, all of these things with the supply chain, you lose just a 0.5%, 1% or whatever, you've got big problems.
Mm-hmm.
And it's not just companies like that. I worry about what's going to happen to veterans with veterans care. I'm very involved in that space. I've talked to numerous individuals that work for the VA, and I'm talking about physicians, nurses, all the way down. They simply aren't going to do this.
Well, let's talk about this because you mentioned. I'm sorry, and I don't mean to cut you off. We just don't have a whole lot of time. You mentioned veterans. We all know that getting into the military, you have to take vaccines. You have to be vaccinated. To send your children to school, they have to be vaccinated. These are mandates that have been in place for decades. And, you know, I don't hear the kind of outcry about those like we're hearing about the COVID vaccine. Why is that?
I don't know. But I do know that I have friends, you have friends that are very knowledgeable, that are hardworking folks with all kinds of, as I said earlier, you know, probably a very large percentage, maybe 15, 20% of the medical profession hasn't been vaccinated. So there are people that feel very strongly that this simply isn't for them. And probably if they'd had to be vaccinated before they joined the military, they wouldn't have joined the military. But the idea of all of a sudden to spring this upon essentially the entire workforce of the nation is going to have a real rippling effect, which I think is going to be very, very detrimental.
Okay.
I would much rather take the tact of using incentives, encourage people to do it, and that's been very successful also throughout many companies.
And that's what I was getting ready to ask you. If not a mandate, then, you know, how do you suggest we get more Americans to get the vaccine? And I do understand this is a personal choice. I understand that argument that people should have the right to choose whether they want it or not. But you yourself got the vaccine, and there's a reason you chose to do that. So clearly you're in favor of the vaccine. So with that said, how do you get more people to think like you?
Well, I think you encourage them. You know, education is good. The fact that, you know, so many people have had it and have been seriously ill. We all know people that have been touched by this disease in a very negative way. So I think you use the incentives of doing it in that way. Rather than, again, just the heavy-handed, you've got to do this, because that narrative really feeds into the big brother approach. But I would much rather see this handled individually by corporations, the way that Tyson's did it, in the sense that, you know, they worked with their employees. They've got a very high vaccination rate. I don't know exactly what they did, but you know, that's something we should commend them for.
Okay.
But the idea that the federal government's going to come down and say, you know, you do this, you're going to lose your job, that's not a good situation at all. And I think based on the labor shortages that we have now and the fragility of the supply chain, it's really going to disrupt our economy at a time that's already disrupted.
Okay, we have less than 3 minutes, and I wanted to kind of switch gears here and talk to you about something else. The key elections that took place this week in Virginia and New Jersey. Virginia now has a Republican governor. New Jersey just barely won on the Democratic side. What do you think this means for the GOP in 2022, next year, as well as the midterm races in 2000, or actually that would be the presidential race in 2024?
Well, as I go around the country and the state, as I said earlier, I hear about labor, I hear about the supply chain. People will grab me and kind of pull me to the side and say, John, you know, who's really in charge at the White House? There's just a lot of unease right now throughout the country. Instead of talking about things that affect people, inflation, all of this, we're coming out with policies that are actually going to add to that greatly. The Green New Deal is part of this massive spending program that the Democrats are trying to get passed. People realize, that's going to increase their gasoline costs. It's already gone up $1.25 since last year. Home heating is projected to be 30% higher this year, and the list goes on and on. And then to come out with the crazy pay-fors, the idea that you're going to, if you have $600 of activity in your checking account, now it's $10,000, that all of that information is going to go to the IRS.
Yeah.
People are pushing back and saying, we're tired of this big government approach. We want to deal with the things that are so very important to the average American.
So with that said, and I'm sorry, it sounds like I'm cutting you off. I'm so sorry. No. We have less than a minute. So, like I said before, you think we're going to see changes next year as well as in 2024 in terms of Republicans taking control again?
The only thing I can say is that these things are usually a bellwether. Republicans will get an opportunity, but they've got to start talking about what they're for. We've got to come out with policies that deal with what I just talked about. And so we're going to have an opportunity, and we are going to start talking about and continue down the path of less government, less taxes, less government in your life on a daily basis, those kind of things. Okay. So I think that we're having the opportunity. We need to take advantage of it and take the American public.
Well, we will keep watching and reporting on it as well. Senator John Boozman, it's so nice to talk with you.
Thank you for having me, and we appreciate your show very much.
We appreciate it.
Say hi to Steve.
Okay, I will say hi to Steve. All right, stay with us. We'll be right back.